Hello viewers, it is my pleasure to welcome Dr. Gurinder Bedi. Hello.
Hello.
Dr. Bedi is the Director and Head of Orthopedics Department at Fortis Hospital, New Delhi. So what are we going to discuss? I think what we have generally observed these days that a lot of people try to postpone the treatment of certain problems which they are facing. For example, let's take the pain in the knees. Sometimes when I even walk up the stairs or walk down, I feel that my knees are paining. But I always say, oh, it doesn't matter, it will go away. But eventually, I feel that one should not avoid or ignore these kind of pains because your body tells you that it needs some kind of attention.
Sure.
So have you come across the cases where they have actually postponed the treatment and then the case becomes worse? So let's start with the pain in the knees.
Sure. Okay. Sharmila, I think it's a fairly important thing that you've raised. So it's a fairly in this country, it's a different thing if you were in a sector like the UK in which getting an appointment with the doctor takes about 3 months, 6 months or something. Here in this country, because of the way the private sector works, you can actually have one appointment with me, one appointment with somebody in my nearby hospital, and you can actually take 10 different appointments and everything.
Yes.
And I think given the level of trust and everything that is prevailing in our society, it's very often that people will keep on actually taking a lot of appointments, and more importantly, they'll go and listen to the neighbor for what they really want or should be done, because it is more in sync with what they think they would want to be done.
Yes.
So the neighbor is much more the important doctor sometimes than compared to the rest of the medical fraternity, really.
Yes.
And again, I'm not here to fight that battle for the medical fraternity, but there is no doubt that some things can be actually cured very easily in a very simplistic way, and sometimes they actually get much worse. Knee is a very, very common thing, mainly because knee ailments are very, very common, whether you're an elderly person, whether you're a sports person, whether sometimes even the teenagers and all are very, very known to get knee issues and everything. It's possibly much more the involved joint in problems rather than maybe the ankle or the hip or something as well, and that's very, very well known. So addressing some of these things can be done very easily with a combination of something like a physiotherapy and exercise, a yoga, avoidance of certain things, adding some more things to your armamentarium of exercise. So as you rightly said, early treatment can sometimes be very, very effective.
Okay. And similarly, the problem in the back, because even students, they are having this problem because again it's related to posture, plus they could be overusing at the badminton court or something. I mean, I don't know. You please throw light on this.
Sure. So, sorry. Okay. So the back is, as you rightly said. So if you ask me, when I look at say maybe 10 patients who come every day, so the back and the knee obviously stands out. Back, knee, and neck really stands out as the commonest joints which are involved. Back is again something which is very, very vulnerable, especially the lower part of the back. More so with that, as I said, the sedentary lives that we lead, the pot bellies that we most of us have accumulated over our lives, the lack of muscle mass, the lack of flexibility, the lack of any activity, poor seating arrangements, people sitting in beds and running their laptops or watching Netflix. All of this has actually contributed a lot to the back ailments, and as you rightly said, very, very common and very, very preventable.
So what do you suggest? What advice would you give if there is a problem, if they come to you with a knee problem? What advice would you give to take on the treatment, not to postpone it? How do you go?
So it's a very generic advice, and I'm trying to offer out here. But one thing we know for sure, that if you keep the joints flexible, that is to keep moving the joint through its full range of movement, that helps in the nutrition of the cartilage. So the worry with joints is the cartilage.
Okay.
Cartilage is that cushion which lines the surfaces of the joint. Cartilage has no nutrition till you actually move it. Okay. So when you move it, fluid moves out of it. When you relax it, fluid moves in it. So the nutrition of the cartilage is totally dependent on the movement.
Okay.
If you start using the joint less and less, may it be the back, may it be the knee, the nutrition of the cartilage which lines the surface of the joints will suffer, and you will end up getting more problems. The second thing is the stress on the joint comes to a large extent from the muscles around the joints.
Okay.
If the muscles are the ones which give you that stability, that strength, and the tone to run the joint in a coordinated and aligned manner.
Okay.
Weakness of these actually causes the joint to be very unstable, and the pressure, rather than being taken by the muscles, being actually put on the joint itself. So flexibility is one, alignment is the other one, and strength of the muscles is the third thing which one should concentrate on. And different joints, different exercises. But remember, the anatomical alignment and the posture is more important.
Okay. Okay. So you said strengthening of the muscles. In the next session, I would like to talk about the guidelines which you want to give, like which you advise, easy guidelines how to strengthen your muscles. So probably we'll take that up in the next session.
Sure.
Thank you so much.
Thank you.
Hope you understood the various tips which he gave, and please do not postpone the issues if they are related to pain in any part of your body. And remember, your posture should be right in whatever movement you do. We will come up again with the next session, which Dr. Bedi will talk about how to strengthen your muscles. Thank you. See you again. Thank you, Dr. Bedi. Thank you.